Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to discuss Lyme disease and tick-borne infections and mold toxicity and about anything else you want to discuss that's a chronic illness. That might even include long COVID, too. So the way that these webinars work, each week you create them with your questions. And so if you are new here, first of all, I'm glad to see new people here. And I'm also glad to see that we've got a lot of returning people who I think are getting value out of these. But the way to participate for you, new people as well as people returning, there's two ways. Number one, write a question to me. And the way you do that, there is a chat box on your screen. You can write your question to me there. I ask that you don't use the Q&A only function. Don't use that. Just write it as a regular chat, okay? I rarely get to those Q&A questions. So for all of those of you that wrote your question in the Q&A area, do not do that. Put it in the chat area, okay? So write a question and I'll answer that, all right? The other way you can get benefit out of these webinars is to see what questions other people ask and how I respond to those. And as many of you know, I try to give background information behind my ideas so that you gain knowledge, which gives you some power over the illness as part of what I describe here for you. For those of you that are participating in the live version tonight, you will be able to see the questions on the screen. They show up on the bottom of your screen. For those of you that are in the recorded versions, though, they don't show up. And so I will wind up reading the questions tonight so that the people that are listening to the recorded versions can hear what we're talking about, all right? So as usual, I am creating a recording of tonight's webinar, and most of the time that recording works out well. If it does go well, look for an email from me somewhere around 9 to 9:30 a.m. tomorrow morning that will announce that the recording is ready. In addition, tomorrow's email will have links that you can use to sign up for our webinars that will be in May. Next week, I'm off in terms of doing the webinars, not in terms of work, but in terms of doing the webinars. I do 3 weeks on a month, and then I usually take a week off. So I won't be with you next week, all right? But you can sign up for the May series. And the thing I would request is if you think you're getting benefit out of these webinars, probably other people you know with tick-borne infections and the mess of illnesses that we all are going to discuss here, people that have those illnesses. So share, send them the email tomorrow morning, send them the links so that they can go ahead and participate in this and learn about what we're doing as well too. Okay. All right. So without any further ado, let's go ahead and get started. One last thing as we do get started here. I cannot get through all the questions tonight, okay? So I know every now and then I get an email from somebody who's very upset with me and claims that I've been avoiding them. I don't avoid anyone. I take the questions pretty much in the order that they show up on my screen. So I don't intentionally refuse to take questions from people, okay? So it's just there's a lot of questions. And so I get through as many as we can. All right. So let's go ahead and get started here. So the first question is from Zainab, and I'm not clear if I'm saying your name correctly or not. I have been on herbal treatments for 3/4 of a year now and made good progress, but I recently plateaued for some time. I suffer from neurologic issues, nerve pain, visual issues, brain fog associated with Bartonella, and have heard rifampin with doxy is excellent for neurobartonellosis. Is it worth a switch to prescriptions, or should I stick with Hutania, Sida acuta, crypto, glutathione, ATP I'm currently taking? I was diagnosed 4.5 years ago after falling ill, and I know neurologic symptoms can be very stubborn to tackle. Any guidance would be very much appreciated. All right. So, there are sometimes the herbal medicines can get you well. The herbal antibiotics are able to get a large number of people well, but sometimes they don't. And, right now your treatment, Hutania, Sida acuta, cryptolepis, that's a powerful herbal regimen. I mean, there's some other ways you could go. You could do a cryptolepis with Japanese knotweed, would be a good treatment, and then use cinnamon, clove, oregano capsules. All right. So you could redesign your antibiotics, herbal antibiotics, to be cryptolepis, Japanese knotweed, and liposomal cinnamon clove oregano capsules, and you would do those 1 pill twice a day. What all 3 of those do, so the liposomal cinnamon clove capsules, the cryptolepis, and the Japanese knotweed, is all of those have been shown to be effective at treating growing and persister forms of Bartonella. And based on my clinical experience, I think they do a good job of getting into the brain too. Okay, but there's times it's just time to say I'm going to go with prescriptions. All right. Now, the disadvantages of going with prescription antibiotics is they tend to stand a greater chance of disturbing your microbiome in your intestines, the bacteria that live in your intestines. But on the other hand, sometimes the prescription antibiotics will be stronger at taking care of the neurologic symptoms and neurobartonella as well too. All right. So there's a couple different ways you could go. So these days, what I prefer in terms of what I am seeing giving some of the best neurologic help is the combination of methylene blue and diflucan. Now, just let me explain that. So diflucan, you may know of as being a medicine we use for yeast, right? Intestinal yeast. It's in a family of antimicrobials called the azoles. And there are studies that came out of Johns Hopkins a few years ago that showed one azole called clotrimazole was quite effective at treating growing and persister Bartonella. All right. The trouble is clotrimazole is not well absorbed, and so it's not useful itself. But about 2 years ago, I decided since one azole would work, let's try another one, which is fluconazole. This yeast medicine's in the same is an azole, okay? And boy, I started having some really good mental clearing in my patients. That was the big thing I noticed, and overall their Bartonella got better. More recently, then, many of us have started using methylene blue, and methylene blue is a drug that is approved by the Food and Drug Administration to treat a condition called methemoglobinemia, which is a condition where in some people, your hemoglobin protein in the middle of your red blood cells doesn't let go of oxygen that easily, okay? So it's useful for people that are in crisis with that, and when they're in crisis, they get an intravenous injection. So it's manufactured only in IV form, but Johns Hopkins University has shown that it is quite effective at breaking down Bartonella biofilm. It's quite effective at treating growing and persister Bartonella. And there's some other advantages in that it can help patch your cell energy factories called mitochondria so they start working better. And that can lead to better thinking and mental clearing as well too. So one of the treatments I go to these days, and before I stopped practicing in May that I was having great success with, was using a combination of methylene blue and fluconazole. That methylene blue, I'd have people take 50 milligrams twice a day. And the fluconazole, I'll have people take a 200 milligram pill 1 time a day, okay? That can be an effective treatment. Now, the methylene blue has to be made by a compounding pharmacy. So it isn't something a standard pharmacy will have. As another alternative to go at your Bartonella, yes, rifampin coupled with doxycycline or rifampin coupled with clarithromycin, which is Viaxin, can be useful for that in some people. Even stronger than the rifampin might be its brother or sister, which is called rifabutin. That's another way to go at it too. But you do have some options. You can either go like a methylene blue, fluconazole, or you could do a doxy with rifampin, or you could do a doxy with rifabutin, and so anyhow, I do think I explained these in my Bartonella article. We'll go there and look here in just a minute to make sure I did. I think it's in there, but we'll look at that. Okay, all right. So anyhow, I hope that gives you some insights. Let me do a screen share here. All right, so if we look in my infection treatment plan section here, and there's an article I have called Kills Bartonella, a Brief Guide. And I break down I described some of the important things you want to do, which is, get at your biofilms, make sure your treatment has something that kills persisters. All right. And then the other thing I should say, if you're having a hard time moving your Bartonella treatment forward, make sure you're on something that's going to break up fibrin. Fibrin is a blood clotting protein that will bind itself to your Bartonella, and then the Bartonella and fibrin will stick themselves in the blood vessel walls, and it gets hard to kill them there. All right. So you can break that down with lumbrokinase, which is a group of enzymes made by earthworms. It's sold as a supplement, and that's 20 milligrams twice a day. I talk about that here, okay? All right, but then down here toward the bottom, I start getting into various treatments that you could look at doing, all right? So one of these I mentioned is a fluconazole-based treatment. There are the rifamycin-based treatments, which would be rifampin or rifabutin coupled with clarithromycin or doxy. I give you these other ones here too. And I even talk about you might want to put methylene blue into there, okay? All right. There's also what I call methylene blue based treatments. And actually, I need to update this. So I like doing methylene blue now with my azoles. Okay, so I mentioned that earlier. I don't think I did that up here. Hold on just a minute. No, so I need to update this article. So I'm finding a lot of success with the methylene blue azole combination as well too. All right. Thanks for that question. Good luck. Hello, Doug. Let's see, Dr. Ross. 2 questions. First, how do you know if you have damaged glycocalyx? My legs and feet tend to get red when I'm standing or when they're exposed to warm water. Second, I know you're not a fan of IgG blood tests to determine mold toxicity. Is it true that they don't detect mycotoxins? But I've now heard of 4 different doctors state that they can tell you if you have current exposure to mold. And I had the whole blood test and it was positive, and it turns out I was being exposed at the time of the test. What do you think? Thank you. All right. So in terms of the glycocalyx, there's something called the endothelial glycocalyx. And so it is a lining of your red blood cells. So your blood vessels, I should say. So your arteries are made up of a muscle wall. Inside the muscle wall is a layer of cells called the endothelium. And then on top of the endothelium is something called the endothelial glycocalyx. And this glycocalyx has the function of making and producing nitric oxide, which helps dilate your small blood vessels further downstream. Okay, so you get better blood flow. The other thing a functioning glycocalyx does is it helps determine what gets absorbed into those endothelial cells and what doesn't. And it also can help prevent blood clots and platelets from sticking together, or even red blood cells from sticking together. So a healthy endothelial glycocalyx results in better blood flow and better vascular health. All right. Now, we know from science about long COVID that the endothelial glycocalyx can get injured. We also know that in certain metabolic diseases like diabetes and in heart disease, that endothelial glycocalyxes can also be injured too. I have wondered, knowing that Bartonella infects the endothelial cells that are part of your red blood vessel wall, if in return then the endothelial glycocalyx might be injured and not work correctly too. The trouble is nobody has done any research looking at that. Okay, so I've even talked to some of the big names in the world of Bartonella research to ask them, are they aware? But there aren't even though I couldn't find any published studies, there aren't even any unpublished studies about that. So what I wonder is in people that are having a hard time getting over their Bartonella, if it might be due to injury to the endothelial glycocalyx, resulting in decreased nitric oxide production and also resulting in microclotting happening within the blood vessel system as well too. All right, I have no science behind that to prove it, but I wonder. Okay, all right. So one of the things that you can do to help repair that endothelial glycocalyx is there is a green seaweed extract where they pull out something called ramen sulfate from green seaweed, and that appears to help repair that damaged endothelial glycocalyx. And the product that does that is a product called Arterosil. I'll show you where that is in a minute. And it's something that can be helpful at doing repair. Okay. Now, in your situation, the fact that you're getting red legs when you stand up means you're getting increased vasodilation, leading to more blood flow. Okay. So what you're describing here, I can't say for sure whether that means you have damaged endothelial glycocalyx or not. And there aren't studies that you can do that say you have a damaged endothelial glycocalyx, unfortunately. You might want to just give it a try for 2 to 3 months and see if it makes a difference. That would be the way to do it. But there isn't a study that you can do that will say you have damage to your endothelial glycocalyx. Again, in long COVID and in heart disease and in diabetes, probably you do. But in Bartonella, I wonder. But I don't have accurate science to tell me that. Okay. All right. And then in terms of the antibody testing that I think it's called My Myco Lab is doing now, I've had a change in thoughts on it. So what they're doing is I misunderstood their test. I thought that their test was looking to see if you had antibodies against mold spores, but rather they're looking to see if your immune system is making antibodies against mold toxins. All right. So they're measuring whether you have IgE antibodies and IgG antibodies. Now, IgG, the problem with IgG antibodies is once your immune system makes them, they may continue making them even when the mold toxins are gone. Okay. There are some experts in the field, though, that think that the IgGs will start going down once the mold toxins are out of you. And some of them will go ahead and measure IgG levels about 6 months after somebody is well to make sure that they're really gone. All right. I don't know that there's true science that supports that IgGs always go away, so I'm still skeptical of that type of an approach. On the other hand, you make IgE antibodies when you're having, in response to something you're allergic to. And IgEs go away in about 3 to 4 weeks after you're exposed to something you're allergic to. All right. So in other words, if you've got IgEs showing up, that means you're probably more recently exposed. All right. So it's kind of a tip that you might more recently be exposed. Okay. All right. Good luck to you, Doug. Hello, MR. Let's see. Hi, Marty. 1. Would a combination of cryptolepis, cinnamon clove, oregano, methylene blue take care of biofilm for various infections? I've had Lyme and Bart for 7 years and have used methylene blue, cinnamon clove, oregano for 2 years, along with many other herbs, but I still relapse every time I'm off herbs. Do you think lumbrokinase might be indicated at this point for better biofilm penetration? Thank you so much. All right, let me answer that first part. I know you got some other questions here too. So, the trouble is with, you may be relapsing, not necessarily because of biofilm. So probably you're on good things that would be breaking down biofilm. I agree that the cinnamon clove oregano can do that. I agree that methylene blue can do that. And so probably you're controlling that. But the one thing you may not be controlling well enough for Bartonella is Bartonella and also Babesia can wind themselves in and out of fibrin in your blood and get sequestered in these fibrin nests. And by sequestered, I mean hidden away. They get stuck on your blood vessel wall, wrapped up in the fibrin. So to break up the fibrin, you would want to use the lumbrokinase. And I usually recommend starting at 16 to 20 milligrams one time a day, and then eventually trying to go up to 2 times a day. It is also true that lumbrokinase can help break apart biofilm, which is a separate issue. Okay. All right. So yeah, that might be something to consider adding. You might be missing your fibrin nest at this point. Okay. All right. Let's see. Number 2, any updates on lufeneron 3 milligrams for 3 days in a row for each 14 days? How have your patients been responding to this versus amphotericin B or itraconazole, for example? Or is it just as potent? Does the die-off from this tend to be bad? All right. So everyone, lufeneron is a chemical that you can use to break up, kill yeast, basically. The trouble is it is very experimental and does not have any human studies regarding safety. Okay. It is sold as a supplement, and I, in the past, would use it when everything else had failed for yeast treatments. The difficulty is I've had a couple people that develop severe allergic reactions to it. And the trouble is, it's a very fat soluble substance. And when something is fat soluble, that means it takes a long time for it to get out of your system. Okay. So I think I even updated my article to say use carefully. And it's not necessarily something I recommend these days. I include it as information in case everything else fails. All right. My go-to medicine at this point, when somebody has failed various yeast treatments, is actually to use amphotericin B. All right. Now, amphotericin B in an oral form is safe. If you read about it and you see all these black box warnings about injury to your liver and your organs, that's when it's given intravenously. But the reason you want to take it orally is when you take it orally, it actually stays in your intestines. It has minimal to no absorption into your bloodstream, and therefore does not lead to any of the bad side effects that can happen when you take it in an IV form. And so amphotericin B works about 95% of the time when other medicines, herbs, or ways of managing yeast are not working. Okay, so that kind of is my go-to. But usually what I'll do is I'll start fluconazole first with nystatin. If that doesn't work, then I might try a different azole and go to itraconazole with nystatin. And if that doesn't work, then I might start looking at trying an amphotericin B. Now, if you're really having a lot of trouble with yeast, it is not just as simple as killing those yeast. You got to make sure you're doing a good job with your diet to support healthy bacteria in your intestines as well, too. So you want to make sure you're having foods, fruits and vegetables that are rich in fiber, and also having a number of foods that are rich in polyphenols, all right? So like blueberries are rich in polyphenols. I think apples are rich in polyphenols. Polyphenols also are a food source for one of the key bacteria that line your intestines called Akkermansia, okay? But anyhow, you need to make sure you're having fiber to feed the good bacteria in your intestines, and you also want to have a diet that has some polyphenols in it as well, too. All right. All right. And let's see. Number 3, have you heard of, or do you have any experience with Araxis IV antifungal treatment for resistant infections? No, I haven't. So I have to look into that. Thank you. All right. So everyone, I'm going to just do a quick screen share here. So to show you a few articles. All right, so in my yeast chapter, you can see a number of articles I have about yeast. One is how do you diagnose it? Another one is something called Kills and Prevents Yeast, a brief guide. In this article, I have a section that says, I talk about amphotericin B, for instance, and I talk about what to do if your yeast are getting resistant, okay? And so I talk about amphotericin, I talk about itraconazole, nystatin with probiotics. And then I talk about terbinafine, which is an option too. In terms of strength, your Ampho has a 95% chance probably getting the job done. Itraconazole about a 90% chance, and terbinafine about an 80% chance, okay? And then I talk about lufreneron as an experimental option, and I have a whole separate article on it as well too, okay? All right. And then I talk about the importance of being on an anti-yeast diet, which usually is going to be foods rich in fiber, okay? And then anyhow, let's see. Yeah, there you go. All right. So take a look at that article. I kind of go through the steps of what to do if you're having a hard time getting rid of your yeast. All right. Good luck, Emma. Hello, John. Let's see. Hi, Marty. A few questions. For drugs and timelines on taking them, both methylene blue and doxycycline taste horrible on their own, and I get nauseous from doxy, and I'm unable to do the methylene blue with just water. As a workaround, can you take lemon juice or lemon powder with either one of them, or does this lower their absorption or effectiveness? I'm already taking doxy and methylene blue about an hour apart from another. Is that okay as well? Also, if attempting to kill off really strong, long-term chronic Bartonella, how high a dose can you go up to on methylene blue? Like, what's the highest you've had a patient on or know they can be on? Wondering because I read it's safe to go 0.5 to 4 milligrams per kilogram, which for me is about 300 milligrams per day. And I think I heard Horowitz says he goes as high as 600 milligrams per day. Lastly, is there any evidence that methylene blue is helpful for SIBO or FIBO? And the second part of your question here is, and how apart do you take the methylene blue from antibiotics and herbs? All right, so I have not seen any evidence that says that methylene blue is helpful for small intestine bacteria overgrowth or SIFO, I think, which is small intestine fungal overgrowth. I haven't seen anything that says it helps with those, okay? In terms of methylene blue, it's very fat soluble, so you could take it with anything. It's going to get absorbed. You could take it with lemon. I would have no problem with that. Doxycycline, the main thing you don't want to take doxycycline or any tetracycline with is calcium-containing supplements or high calcium foods. Lemon would be fine. The only thing I would worry about is the doxycycline is very acidic and irritating to the stomach lining. And lemon is acidic as well, too. So you might find more stomach upset by taking your doxy with lemon, unless you're already doing that, okay? You might want to consider, instead of doing doxy, looking at doing clarithromycin, which is Biaxin, or azithromycin with your methylene blue. The Johns Hopkins studies show that the combination of azithromycin with methylene blue or the combination of rifampin with methylene blue tend to be your strongest persister and biofilm busters. Okay, so just be aware of that. Okay, all right. And then let's see, in terms of high doses, the trouble is we don't have good human studies. And I know I've been to some of these lectures where people say, you can go up to 4 milligrams per kilogram. The trouble is their science that they're using is not adequately verified. Okay. I know Horowitz, because he's putting people on such ridiculously high levels of dapsone, has to wind up using high doses of methylene blue to keep these people from rupturing their red blood vessels, basically. All right. So that's why he's pushing so high. The trouble is we have no long-term studies knowing what the impact is of people that go on those kind of doses. Okay. And by that, I mean the methylene blue. In my own practice, the highest I've gone to with methylene blue is up to 100 milligrams twice a day. It is such a fat-soluble medicine, it's doubtful you're going to get much more advantage in terms of antimicrobial effect by going higher than that. All right. So that you asked what's the most I've done. I've done 100 twice a day, and it's not minimal benefit, but I just don't. We don't have long-term studies of repeatedly using methylene blue day in, day out. Usually methylene blue, the studies on methylene blue about human safety studies are done looking more at the use for methemoglobinemia, which is usually only used when somebody is in a crisis with their methemoglobinemia. And in other words, they don't take it daily. It's only used every now and then. So I think we need to be cautious about using high doses of these medicines when we don't have long-term safety studies, even though it should be safe. You know, the more you take, the longer you take, the greater chance you have of something going wrong, basically. Okay? All right. Good luck to you, John. Hello, James. Hello, Dr. Ross. Thanks for these great webinars. You're welcome. I had a bacterial infection in my nose 9 years ago. The specialist had me take a few courses of antibiotics and it came under control. He then told me to put a pea-sized lump of polysporin in each nostril twice a day until further notice to keep it under control. I think the doctor is retired now, and I'm still putting polysporin in my nose twice a day, and it's been under control since. Would continuing the polysporin cause any problems with the nasal microbiome or anything else? I'm not sure if I should try to stop the polysporin or not. Boy, you know, I haven't seen anyone use polysporin that way, and it seems to me this is something he came up with on his own. Okay, I would be concerned about changing the balance of bacteria in the normal microbiome of the nose. I would be concerned about that. I agree with you on that. You know, you might try to stop. I mean, you should talk to your own doctor. I'm not your doctor, okay? But you might want to consider talking to your doctor about stopping it and see. You may not need it anymore, all right? And I'm not sure it was even working anyhow, to be quite honest with you. I haven't seen somebody do that before. All right. Good luck to you, James. All right, James. It's like, I'm not sure if it's the same James, but let's see. Hi, Dr. Ross. I've been on your herbal protocol for Lyme and Bart for 3 years, but not seeing any significant improvement in brain fog and fatigue. I had methylene blue to the herbal regimen, which significantly helped, but cannot tolerate the high dosage of 50 milligrams 2 times a day. My LMD dropped it down to 5 milligrams twice daily, which I can't seem to tolerate higher as it's so stimulating. I had to cut coffee, but it did not clear all the symptoms, brain fog, fatigue, etc., but did not have any hercs. Any ideas what I can do to progress this treatment forward on methylene blue? Also, resting heart rate increased to 85 beats per minute while on methylene blue. If I stop methylene blue, Bart symptoms come back in a few days. All right. So first of all, I would consider adding an azole to your treatment. I have found, as I mentioned earlier tonight, I have found benefit, especially in difficult to treat Bartonella, by being on either Fluconazole, 200 milligrams a day, or itraconazole as a 100 milligram pill, 2 pills 1 time a day. Again, the azoles have been shown by Johns Hopkins University in laboratory experiments to be effective against persister and growing Bartonella. And in my own clinical practice, I saw really good central nervous system brain effects from using azoles to go after Bartonella too. Okay. Number 2, keep in mind with methylene blue, it's extremely fat soluble. So when you drop your dose down from, let's say, 50 milligrams twice a day down to 5 milligrams twice a day, your body levels of the drug do not drop that quick. All right. It may take even a month or so for your body to normalize back to that, to what would be the equivalent of the 5 milligram twice a day dose. Because basically you have all these stores of methylene blue sitting in your fat, and it takes a while for them to come out. So what you might try to do is, you know, come off your methylene blue or go to your 5 milligrams twice a day for about 3 weeks if you can. And then if that seems to be less agitating for you at that point, then try to slowly increase it, maybe to 25 milligrams twice a day, and see if you can tolerate it. But keep in mind, dropping down to 5 milligrams does not change the overall load of the medicine in you that much, because that overall load that's been stored away in your fat is going to take about a month to get out of you. And so during that time, you're going to have stimulation from the dosing you had before. All right. All right. Good luck to you, James. Hello, Sarah. Let's see. Hi, Dr. Ross. I was just prescribed itraconazole. I've heard so many bad things about this drug, and I'm wondering what your thoughts are. You know, you can hear bad things about anything. I'll just start by saying that, okay? The main side, there are two things to be concerned about itraconazole, and I see them rarely. Number one, any of the azoles like fluconazole and itraconazole can lead to hair loss, all right? In my practice, and I use a lot of fluconazole, a lot of itraconazole, in my practice, I rarely saw somebody with hair loss. And in fact, I think in the nearly 20 years of practice using these medications, I saw maybe 2 people develop hair loss problems. Okay, so it's rare. All right. The second thing that you'll hear people, physicians express concern about is that being on fluconazole or being on itraconazole longer term may lead to liver inflammation. We're all taught that. Okay. But the truth is, I never saw it happen. I've used, again, 20 years of fluconazole, and then maybe in the last 5 to 10 years, lots of itraconazole. And I've used it for month on end and never saw anyone develop liver inflammation on it. But yet, we're taught to be concerned about liver inflammation from it. My practice at first, when I first started using fluconazole daily for 30 days to treat intestinal yeast overgrowth, I tested everybody's liver enzymes at least once a week to make sure that I wasn't harming their liver. And I never saw anyone's get elevated. And after doing that for maybe a year or so, I just stopped. It was pointless. All right. So there is a myth out there that these are extremely irritating to the liver, but the reality is, clinical reality is, that has not been something I've seen. Okay, all right. So anyhow, I've used a lot of that in my practice, and I haven't had problems. All right, other than 2 people that had hair loss issues, and their hair will grow back once you stop the medicines too. Okay. Hello, Maureen. Let's see. Hi, Dr. Ross. I'm taking cryptolepis, Japanese knotweed, methylene blue, and cinnamon clover and oregano essentials for Bartonella infection. Also starting the Gupta program soon. Symptoms increased 2 months ago with almost constant extreme debilitating fatigue and pain that keeps me mostly bedridden. Are there any Bartonella treatments that I could add? Is it important to take a zeolite binder daily? Is blue light harmful? Try not to lose hope. Thank you for any thoughts on this and for all you do. All right. So when I see, Maureen, when I see that somebody has a situation where it turns worse all of a sudden, they've been doing better and it gets a lot worse, you have to wonder about intestinal yeast overgrowth having entered into the picture. All right. So, as you know, when you have a chronic Bartonella infection or you have a chronic Lyme infection, one of the main reasons you feel poorly is that your immune system responds to these infections by making cytokines, all right? And cytokines are good and bad. On the one hand, they turn your immune system on, they help draw white blood cells to where the infection is, and they help those white blood cells work better. So that's all great. That's good stuff, okay? But if your immune system is not doing a good job getting rid of these problems, it's going to keep making more and more cytokines. And eventually it's too many cytokines that give you most of the symptoms we call tick-borne infection symptoms. So it gives you fatigue, bad fatigue, okay? Gives you achiness, makes it so you can't think, interrupts with how your hormonal systems work, et cetera, all right? So when somebody suddenly gets worse, I think, what else is triggering all these cytokines? And from being on antibiotics, even herbal antibiotics, you have increased risk of developing intestinal yeast overgrowth. All right. So you might want to explore that with your physician. All right. But symptoms that would make me think of intestinal yeast overgrowth are a big decline. All right. Number 2, increased sugar cravings. Number 3, if you have sugar, you feel a lot worse right afterwards, that's can be a sign. In other words, if you feed your yeast with sugar, you will feel bad right away. Okay. And that is if you have intestinal yeast overgrowth. Another symptom that can indicate intestinal yeast overgrowth is those yeast in your intestines release toxins that get into your bloodstream and will interact with your skin, leading to worsened pimples and acne, worsened eczema, worsened psoriasis. So any skin manifestations that you have that get worse, all of a sudden that can indicate too many yeast in your intestines. Another symptom to look at in a woman is if you're starting to get frequent vaginal yeast infections, that can indicate intestinal yeast as well too. All right. So consider intestinal yeast. Now, as you may have just heard me mention earlier, if you do have intestinal yeast, adding fluconazole to treat your yeast will also help treat your Bartonella as well too. All right. All right. Good luck to you, Maureen. All right, let's see. Hello, Sally. Let's see. I have Bart, Babs, mold, long COVID, treating all 4. How do I differentiate which is flaring? It's so confusing. I got to tell you, that's a hard one. I recently put together a long COVID protocol, and in there, I said determining what is the problem, whether it's long COVID or reactivation of your tick-borne infections, is really more of an art than a science. We don't have any tests at this point that can tell us whether your main problem is long COVID or whether it is because you have Bart, Babs, or mold that are causing a problem. Okay. One clue to look at is how were you doing before you got COVID in terms of your symptoms with Bart, Babs, and mold? In other words, were you in pretty good shape? Were you in moderate shape? And then if you got long COVID, if you just felt like you never recovered, most likely it is not due to a reactivation or worsening of your underlying tick-borne infections and mold. It probably is because of the long COVID. Okay. And you might want to take a look at my long COVID protocol. If you were to go, I'll show it to you here in a minute, but it's quite extensive because the problem with COVID is that it actually, there's a number of things we now understand that happen with people with long COVID. Okay. One is when the COVID virus attaches to your ACE receptors to get inside cells, one area rich in ACE receptors are your blood vessel walls. And so you get damage to the endothelial glycocalyx. I talked about that earlier. All right. Which leads to diminished blood flow and may even cause all those microclots that you might hear about when you're reading about it. Okay. So you get blood vessel and organ damage. You may have ongoing pockets or reservoirs of the virus still. The COVID can injure how your mitochondria work. COVID also causes disruption in the healthy gut microbiome, and that needs to be fixed. COVID also can cause immune balance problems, and there's things you can do to fix that. And then finally, COVID can interrupt serotonin production within the intestinal tract, and that leads to a lot of your cognitive problems and may even lead to a lot of those symptoms of POTS that people have as well too. All right. So I'm not going to go through my whole long COVID protocol here, but I'm going to show it to you so you can read through it. It is extensive because to get well, it appears from some limited science that you need to address all of these factors at the same time. All right. And I know it's extensive. You're going to see it. You're going to go, oh my God. But it is a protocol that has some scientific foundation behind it and some success in people pursuing a variety of these causes all at the same time. Okay. All right. Let me show you that article here. Okay, so take a look in my latest tab here, and this is my article about long COVID. All right. Keep in mind a number of these things you're doing for long COVID, you're probably already doing as part of your Lyme and Bartonella and your Bartonella and your mold toxicity treatment. Okay, but take a look at this article. All right, and then to answer your question, it is so difficult to determine what is active sometimes that it actually helps to have somebody can look at it with you. All right. And as I say in that article, it's kind of more of an art determining what's active and what isn't. And so you want to work with a physician who has worked with long COVID and worked with tick-borne illnesses. And these days, most of your doctors that are treating tick-borne infections are having to deal with long COVID as well, too. So they probably have some sense of what's happening with you based on your clinical story. Okay? All right. Good luck to you, Sally. Hello, Linda. Let's see. What do you think of hyperbaric oxygen chamber for Lyme and Bartonella long term? So, hyperbaric oxygen, when you're doing hyperbaric oxygen, basically you're going into a tank that is highly pressurized, and they use 100% oxygen at the same time. So, under pressure, with that pressure, if you're on antibiotics, they're going to be forced into the tissues more deeply. Okay. The oxygen as part of this may help kill infections, but probably doesn't do that good of a job, to be quite honest with you. A number of years ago, there was a movement, and this is probably about 10, 15 years ago. A lot of Lyme doctors were putting hyperbaric tanks in their offices. And in the end, the majority of doctors were disappointed in the results that they saw. Okay. These days, the only people I really recommend hyperbaric oxygen for is I don't recommend it as a means of improving your germ treatment, even if you're on antibiotics. I don't think it's a good germ killer either. But the one thing it's useful for is in people that have a lot of cognitive difficulties and brain neurologic deficits. And the reason that hyperbaric oxygen may help in those situations is it helps with something called neuroplasticity, which is the ability, it helps nerves repair themselves and recover. Okay. All right. So the people that in my practice who I tended to refer for hyperbaric oxygen were people that might be a year or two into treatment, and cognitively we are just getting nowhere. They've got difficulty using some fingers because they're not getting the nerve signals. I might use hyperbaric oxygen in those kind of situations to do brain repair, basically. Okay. All right. Good luck to you, Linda. Hello, Linda C. What is the best line of defense regarding Japanese knotweed? Is resveratrol the same as Japanese knotweed? Do you recommend the liquid one on your site? All right. So resveratrol is a component of Japanese knotweed, but Japanese knotweed is much more than that. There's germ-killing components too. The resveratrol itself, I do not believe, is the germ-killing component. Resveratrol can actually help lower cytokines, but there's other components of the Japanese knotweed, I believe, that are doing most of the germ killing. Okay. So on my site, the tincture that I have from Montana Pharmacy is an extract of the whole plant. So it's got resveratrol in it, plus all the germ killing chemicals in it as well too. Okay. Good luck, Linda. Hello, Diane. Let's see. Have you come across patients diagnosed with Parkinson's who ended up having tick-borne illness? How do you go about ruling that out? I'll share this with a friend. All right. So, Borrelia and even Bartonella can be a cause of Parkinson's, can be a cause of multiple sclerosis, can be a cause of Lou Gehrig's disease, also known as ALS. Okay. So these severe neurologic problems can be caused by tick-borne infections, especially Borrelia and Bartonella. All right. Now, in neurology, when people get a neurologic diagnosis, most of these are what are known as syndromes, all right? So and they're basically what I call neurologic constructs. So we say you have MS because we see lesions in your brain and we call that MS. That doesn't tell us what caused those lesions in the brain, all right? Parkinson's, we say you have Parkinson's because you have certain neurologic manifestations like a flat face, you don't express yourself a lot, you have stiff movements, you may have to shuffle your walk, all right? But it doesn't say what caused it, okay? Now, so to see if it's possible that tick-borne infections could be a cause, you have to do good testing, right? And so the best testing to see if there's a possibility of these infections being in you is to see if you've got an antibody reaction against them. The lab that is doing the best work with its antibody test these days is IGeneX, which has an antibody testing technique called an immunoblot. And so they have an immunoblot for Lyme, which is Borrelia, Babesia, Bartonella, and tick-borne relapsing fever. But their immunoblot has the ability, a sensitivity, the ability to find evidence of these infections, having been in a person, of about 93%. That's about the best way we have of looking at it, okay? Now, if you get a positive test back, then you're left wondering, is your Parkinson's really Lyme disease, for instance, or is it Parkinson's and you also have Lyme? There's no real way of saying, right? So what I'll do with patients that I've tested, they have MS and they have Parkinson's, and I test and they come back positive for tick-borne infections, I tell them, let's try to treat for the tick-borne infections and let's see if your MS or your Parkinson's gets better, all right? That's the best we can do, all right? All right, good luck to you. Good luck to your friend. So Sharon, I think you're wondering, is there a time frame? So, I will tell you, Parkinson's that is caused by Borrelia or Bartonella, or MS that's caused by Borrelia or Bartonella, in my experience, only gets helped about 25% of the time with that. The neurologic symptoms get helped about 25% of the time. The other symptoms that people get, like the fatigue and the body pains, those get helped an additional 50% of the time. So 25% you get neurologic symptoms, can improve on antibiotics. There's another 50% group that also gets improvement in the physical symptoms that are not neurologic. And then you have 25% that get no benefit at all by doing antibiotics. It is true that the longer the injury is there, it's going to be harder to make changes. I don't have an actual timeline because I have seen people that have had these illnesses for years actually respond to antibiotics. Although we'll admit, on the whole, the longer it's in you, the harder it's going to be to respond to the antibiotics. Okay? All right. Hello, Dana. Let's see. Or Dana. I'm not sure what your pronunciation is there. Hold on here just a minute. Let's see. I have Borrelia and other co-infections in remission for a number of years. Congratulations. But I play whack-a-mole because Lyme, I assume Borrelia, combined with an autoimmune gene damages dendritic cells, resulting in immunosuppression. But between that and a couple healthcare professionals, we've managed to keep my quality lacking life going. But now I'm dealing with a relatively unknown pathogen, Protomyxoa rheumatica. The first round of a no-fat, low-fat diet, I took 2 malaria herbs in addition to my regular remedies, and 1 for Toxoplasmosis gondii, which evidently comes with it. I also had E. syncestu. Anyway, I'm on my second round of the unsustainable diet, and I've been taking a mixture of biofilm busting EOS sublingually in a capsule and in colonics, which is what I used when I had neurocysticercosis, but that takes a long, long time. A couple of professional homeopathics came up when I searched on the site, but I can't get anyone to commit to my answers regarding this. Okay, so I have to be honest with you. I don't believe in protomyxoma. Dr. Fry is the one that came up with this idea. It has never really gained a foothold as an idea that most Lyme doctors deal with. I personally think what he's seeing under the microscope when he looks is really an infection that can be even found in healthy people. So just seeing it there doesn't mean it's causing your problems. The reason I think that a number of people get better on his treatment is the drugs he uses treat babesia, and I think he's been using some stuff that actually treats Borrelia at the same time. I'll just say that I don't subscribe to that school that it is actually a cause of problems. Just seeing it in your blood by Dr. Fry in his lab doesn't prove it is a pathogen to you. Okay. All right. In other words, it could live there even in healthy people as well too. Okay. Good luck to you. I'm sorry I don't have good input for you here on this one. Hello, Linda. Let's see. Which treatment do you like better, the herbal or the methylene blue fluconazole? I read there are a lot of side effects to the diflucan. I don't necessarily like one better or not. A lot of that depends on what the person wants. So I will lay out options to them. And what I have found in my practice doing integrative medicine, because I work with acupuncture, I needle people. All right. I work with herbal medicines. I work with diet. I work with craniosacral therapy, and I work with prescription medicines, right? I work with all those. And at one time I used to think, how in the heck am I going to choose the right way for a person to go? Well, I don't choose. I recommend to people. I say, all right, we could do these antibiotics, and I describe what they do. Or we could do these herbal approaches. Or when people have musculoskeletal problems, I might say we can do acupuncture. I mean, whatever. Okay, so I just explain, here's your options. And what I have found over time is that people have an internal knowing that will draw them more to one type of treatment approach than another. So if you, for some reason, so in other words, I think the herbs have as good a chance of helping you as the prescriptions, not relatively. Well, there may be about a 5 or 10% less chance the herbs will work. But again, they still work in a lot of people. Okay. All right. And so I think if you're having a lot of hesitance to the methylene blue fluconazole, trust that hesitance, okay? Trust your knower. And if you're more drawn to doing the herbs, go with the herbs. I think our body knows what's going to be best for us, all right? All right. Good luck to you. Let's see. Hello, Shannon. Let's see. I have Bart and I have MS. How do I tell the difference of what causes which symptoms, or does it even matter? So it doesn't matter. That's what the comment I was making earlier is I would just treat for the Bart and see if the MS for symptoms get better. Okay. All right. Good luck to you. Hello, John. Let's see. Hi. How far apart do we need to take methylene blue and doxy from each other? And then how far apart, like in hours from other drugs? I don't think you have to separate them. I think you can take them all together, to be honest with you, John. All right. Good luck. Let's see. Hello, Joe. Let's see. Have you had any problems with disulfiram and mast cell activation syndrome? I never saw. I eventually stopped using disulfiram. I think in the end, it wound up being more of a disappointing drug. There were a few people that did get good benefit, but on the whole, it's very difficult to take medicine. And even when people would get improvements, they would not be long lasting. And I think these days we've got much better options to treat persisters, whether that's persister Bartonella or persister Borrelia. We have a whole host of herbal options now. We've got Methylene blue, we've got Fluconazole. We have other ways to treat these illnesses, right? So, but during the year and a half to 2 years, I was using disulfiram with some regularity, I never saw anyone develop mast cell activation. Now, keep in mind, anything can trigger mast cell activation, though. So maybe it did do it in you. Okay. All right. Good luck to you. Hello, Sam. Let's see. Hi, Dr. Ross. Did you say only 25% of people get better on your antibiotic protocols? No, I did not say that. I'm not sure what you heard there. I said, I did say that for MS and Parkinson's, 25% of people get relief of their neurologic symptoms, while another 50% of people can get relief with their physical manifestations beyond the neurologic. In terms of what I see with the various prescription and herbal protocols I recommend for Borrelia, herbal options versus prescription options will work about 85 to 90% of the time. Okay. If you go with IV antibiotics, you may have a chance that you may have a 95% chance of getting better, but there's a lot of risk in doing the IV antibiotics. All right. So herbal and prescription for Borrelia, I give equal chances that any combination you go on, either herbal or prescription, has about an 85 to 90% chance of working. All right. And if one set doesn't, you go to another one. All right. All right. Then for Bartonella, I find that prescription options work about 80 to 85% of the time. Herbal options work about 75 to 80% of the time. All right. But you may be one of those 75 to 80%. All right. And then for Babesia, I find that prescription options work about 80 to 85% of the time, and herbal options tend to work about 80% of the time. So when it comes to Bartonella and Babesia, there is a slight decreased chance of effectiveness with herbal antibiotics versus prescription antibiotics. Okay. All right. Thanks for your question, Sam. Hello, Jordan. Hi, Dr. Ross. Do you have any recommended herbs for tick-borne relapsing fever? In general, tick-borne relapsing fever, I tend not to treat herbally because I find doxycycline prescriptively tends to be very effective against that. All right. And usually I'll try doxy for about a month and see if it works. Now, if it doesn't, and we're starting to look more at this being a true chronic problem, in which case I think any of the herbal antibiotic protocols I recommend for Borrelia, Lyme Borrelia, will work also for the relapsing fever too. Okay. All right. Good luck, Jordan. Hello, Sam again. Let's see. I have burning pain in my legs and have been diagnosed with small fiber neuropathy. I'm not sure what infection this is from, but can you advise on how I can treat and renew my peripheral nerves? All right. So when you have small fiber neuropathy, the way that that's diagnosed is with a skin biopsy, and they will actually see that your small nerve fibers are injured. Okay. That's how it's technically diagnosed. If you have been diagnosed with small nerve fiber by biopsy, you would then qualify for one way to treat small nerve, the small nerve fiber, and that is to use intravenous immunoglobulins, or we call that IVIG. That is the one purpose that IVIG is approved for. Okay, all right. So that's a consideration. All right, all right. But the other thing you can do that I have seen is if you have tick-borne infections like Borrelia or Bartonella, sometimes getting those infections under control with herbal or prescription antibiotics will help. In addition, you want to take steps to repair your nerves, all right? And so the things that can repair nerves are, number one, be on glutathione. So glutathione is a very strong antioxidant that's made in every one of our cells. Its job is to repair damage. So if you have damaged nerve cells, they probably have exhausted their glutathione gas tank and they need more, okay? Also, when you have nerve injury like this, it is very likely that the nerve cells mitochondria, their power factories, are also injured, and glutathione can help repair those from the inside. Okay, so glutathione, all right. Number two, I would do things to repair the lipid cell membrane layer, or the cell covering, which is made up of similar fats as your mitochondria membranes are made up of. And that is to do phospholipid repair. And one of the things that you can use to do that is a product by Research Nutritionals called ATP 360. It's made up of a phospholipid mix that will get absorbed and will eventually repair the nerve cell membrane. But then as the nerve cell membrane gets saturated, it leaks down and actually repairs the mitochondria membrane. Okay, all right. I would also try to lower inflammation in those nerves by being on curcumin, 500 milligrams 3 times a day. I like a liposomal variety. The product I like for that is curcumin phytosome by Thorne. All right. And then finally, one other thing that can help with nerve repair is to use the peptide called BPC 157. BPC 157 is a peptide that occurs naturally and is made by our stomach lining, and its job is to help intestinal function. But we know that it can help repair mitochondria. It can help balance out your immune system to make it less inflammatory, and it can repair tissue injury like muscle, joint, and tendons, and even nerve injury as well too. And so I'll have people take BPC 157 one pill twice a day. Okay, right. So I have an article about how to repair peripheral neuropathy. What I discuss in that article would apply to the small fiber neuropathy as well too. Let me show you that article here. All right, so look in my brain and nerve section here. There it is, my brain and nerve section. And look at this article on peripheral neuropathy evaluation and repair. I talked to you just about basic testing you should do that help make your nerves work correctly. All right. I talk about getting rid of the things that are irritating the nerves, including infections and mold toxicity. And then I talk about the steps you can take to repair the nerves. Okay. And I lay it out all in this article. So take a look at this too. All right. All right. Good luck to you, Sam. Hello, Sandra. Let's see. How to treat neuropathy in arms and legs, Bart or Lyme cause. Do you ever use Pectazole in your treatments? Thank you. All right. So, Sandra, all the comments I just made to Sam about his neuropathy would apply to you. Okay. And I use Pectazole, which is citrus pectin, mainly for 2 reasons. Number one, it's a good food source for healthy bacteria in your intestine. So sometimes I will use it when I have people that have repeat yeast infections, and we try to get them to add dietary fiber, and that just isn't, I have a hard time doing that, then I might add Pectazole to do that. Okay. All right. And I would do probably, if you have the powder form, I'd do a scoop 3 times a day, or at least 1 or 2 pills 3 times a day for that purpose. Okay. All right. The other thing that Pectazole can do, citrus pectin, is a useful binder of mold toxins. And so if I've got somebody that cannot tolerate the cholestyramines and cannot tolerate the multi-pole by research nutritionals or GI detox by biocide and botanicals, then I might look at doing a pectazole. Compared to cholestyramine and compared to the mycopole and compared to GI detox, it tends to be less constipating. All right. So that would be a situation I might consider using it into. Okay. All right. Good luck, Sandra. Hello, Sally. Let's see. I have Bart, Babs, mold, and long COVID. Oop, I think we answered that one earlier. Let's see. Bear with me. Some people posted their questions in two different places, and I'm removing some of them here. Let's see. Oh, yep. These all answered. All right. Go back here. Sharon says, let's see. Hi, Sharon again. Let's see. Sorry, I wasn't clear. I was wondering if there is a time frame for antibiotics with Lyme. So in terms of how long does it treat Lyme, on average, when you have chronic Borrelia, chronic Lyme, you're talking 1 to 2 years of antibiotics, unfortunately, for chronic. Okay. All right. That has been shown. So that's been my experience. Also, if we look at some data that came out from a group called MyLyme Data, they're an arm of LymeDisease.org. They're a research arm of LymeDisease.org. And they currently have, I believe, about 19,000 people living with Lyme in their data bank where they can periodically ask these people questions. And a number of years ago, I think 3 or 4 years ago now, they did a project asking people, what did it take to get them well? All right. And the average person in there that had recovery, there were 3 things they found in their studies. And people, could have tried colloidal silver. They could have tried hyperbaric oxygen. They tried everything. But in the end, what their studies showed, the things that work best to get people well, number 1, working with a Lyme literate medical doctor or Lyme literate physician that can help you navigate through and find your way through this mess. Okay. All right. Number 2, being on antibiotics. All right. Now, they did not specifically break out herbal antibiotics, and I think that that's a missing part of their study, but their data said prescription antibiotics, but they didn't specifically ask for the herbal antibiotic question. Okay. So I think herbal antibiotics can be part of that too. Okay. All right. And then the third thing is using those antibiotics for a year or more is what it took people to get well. All right. So that's what the data even shows us as well, too. Okay. All right. Good luck. Let's see. Hi, Diane. Do you always have to do provocation testing to get an excessive result for tick-borne illness if they progress quite far along? Thank you so much for all you do. So at one time, when I would, so provocation testing, basically everyone means taking antibiotics first for about 3 or 4 weeks, and then doing your testing, your antibody testing for Lyme. Okay. So the idea is that one of the things that happens with Lyme is that either due to immune suppression or the germs being hidden away in tissues, the immune system has a hard time making antibodies. All right. And if you first use antibiotics for 3 to 4 weeks, you'll get killing of the germs. Tissues don't hold on to dead germ parts. They release them into the bloodstream. And then when they release these dead bug parts into the bloodstream, the immune system now can see it and we'll start making antibodies. All right. So the testing that doing provocation can help with is the immunoblot and Western blot methods. All right, those tests, those are antibody tests. Okay. By comparison, and might even help with the ELISpot method as well too, which is a T cell reaction test where we're measuring whether your white blood cells called T cells react against germs. Okay, so they may be more reactive if they get to see the dead bug parts as well too. All right. By comparison, if you're going to be doing PCR testing, which I generally don't recommend, or if you're going to be doing fish testing, or if you're going to be doing Igenix's new enhanced culture PCR test, you don't want to kill germs first. You want your germs to be thriving in you so they can be measured, okay? Because those tests measure the germs in you. And the trouble is with any of those PCR related fish tests or PCR cultures is we don't know what their true ability is to find an illness. It's true. When they come back positive, they're real. All right. Because if you got the DNA of a germ in you determined by PCR, you've got the germ in you. The trouble is with PCR testing is you've got to have a lot of the germ in you so that when you put the needle in and draw the blood, it picks up those germs, right? They have to be swimming by the needle at the same time. And no one has done adequate studies to tell us what is the sensitivity, the ability of those PCR and fish tests to find the infections when they're, we just don't know. Okay. All right. So you could do it. These days, the immunoblot has gotten so sensitive that Igenix is doing. I don't find the need in the last year or two of my practice to keep doing the provocation testing, to be honest with you. It's a very sensitive test and very reliable. Okay. All right. Good luck, Diane. Thanks for the question. All right. Believe it or not, that's it. I've gone through all the questions here tonight. Rarely that happens. So if anyone is still here, I'll give you a couple minutes to see if there's any more questions that are going to come through to me. But at this point, I think that's it. All right. Well, let me take this time while we'll see if there'll be more questions, but let me do a quick screen share here. Let's see, there we go. Let's see. All right, so I know a lot of you are getting benefit from my webinars, and I just want to, if you are not aware, I run a support group called Lyme United. It's a membership group, and I invite you to join me. If you are getting a benefit from my free webinars, my conversations with Marty Ross MD, Lyme United is like my free webinar on steroids. Okay, there's a lot you're going to gain here. We have a very active group of members, very knowledgeable members that are actively involved in writing to and supporting each other, and even coming up with ideas that I haven't thought of before. So it's a very knowledgeable group. We have a number of forums here that people can participate in. So basically, we have a forum where people can introduce themselves. We have a forum where members write to each other and ask questions that are more supportive of each other. We have a forum called Share Your Wins on Wednesdays, where I want people to tell us what's working so we can learn from it. Daily, I respond to questions that are written to me in office hours with Marty Ross MD. And then once a week, I host a Zoom room called Ask Marty Ross MD Live, where I take any questions people might have, but it's in a Zoom setting so that I can actually ask questions and clarify. And then what's really fascinating is our members all pipe in and give their ideas too. So we develop a community-based response that can be quite helpful. And then finally, we have a member forum where people can host their own events. All right. So I invite you to join us in this. I'm looking for more members. And again, you'll have much more access to me and Lyme United than you get in our weekly conversations with Marty Ross MD. So I invite anyone, to take the time to join us here. All right. If you are interested in joining, take a look over at Treat Lyme by Marty Ross MD to my Lyme United page here. And you can read through here and see if we really are right for you. And it has how you subscribe is in this page as well too. Okay. So join us here. Hello, Jean. Let's see, how do I access the herbal antibiotic treatments? So there's two ways I can answer this. Number one, I have written within each of my key treatment articles, my article called Kills Babesia Brief Guide, my article called Kills Bartonella Brief Guide, my Lyme Disease Antibiotic Guide, and my Ross Lyme Support Protocol. All of those have herbal options built in them. Okay, so that's one way. But if you're asking where do you get these herbal medicines, let me show you where you can get those. All right, so I have a supplement store called Marty Ross MD Supplements. This is where my patients would buy their supplements when I was practicing, and I've kept the store going. It's a very vital store. And basically, I've curated for you some of the most active and best products that are out there, right? The problem with supplements, there's a lot of garbage, but I've tried to take the guesswork out of it for you by picking the products myself. So if you're interested in seeing what do I recommend, you can use my store for that. You also can buy from me, so anyone can use my store, all right? So if you want to see the herbal antibiotics, the big company that I use for herbal antibiotics is Montana Pharmacy. And they have a variety of herbs, and you can find them all here, okay? The other herbal antibiotics that I use a lot of, and actually you can find these, I'm sorry, I should point you in a different direction. Look under my infection section here, and you'll find any herbal antibiotics that I have, you're gonna find here. A lot of these are Montana Pharmacy, but also there's the biocidin products. I have yeast killers here. I have grapefruit seed extract. I've got all kinds of herbal antibiotics from different brands as well too. Okay. Right. Now, so again, anyone can purchase from here. Keep in mind when you purchase from me, that supports me so I can keep running free webinars for everyone as well too. All right. Other reasons to order from me is that we ship fast. If anything comes in Monday to Friday before 2 p.m., it ships out the same day. We ship it over to U.S. Postal Service, okay? Number two, I cover any taxes you might have. And number three, shipping is free as long as your order is over $50, okay? All right. So I invite you to buy your products from my store as well, too. I'd appreciate that. All right. And then finally, if you're looking for my protocols, take a look at my online Lyme guide here and look at my infection treatment plans. And in here, you'll see my Lyme disease antibiotic guide where I have both prescriptions and herbal options. You'll see my article on how do you get rid of Bartonella, which has herbal and prescription. Kills Babesia has herbal and prescription, okay? And then finally, my Ross Lyme Support Protocol is a good starting point of where you begin in designing a Lyme, Bartonella, and Babesia treatment. Okay? All right. All right. Thanks for your question, Jean. Let's see. Let's see. Some people are making comments, but they're not really questions. And just bear with me here as I get some of these cleared off. Anna says, thanks. You're welcome, Anna. Hello, Linda. Let's see. What do you recommend for herbal Lyme treatment? Also, my doctor said they can't test for babesia right now as the lab isn't able to do it right now. Have you heard of this? No, I haven't heard of that. I'd have to look into it. I'm not aware of that. And in my support group, no one's been indicating that as well either. But I'm not aware of that. Okay. In terms of the herbal, my starting point for an herbal antibiotic regimen for Borrelia Lyme would be to use a mixture or to use 3 different products. One is cat's claw, the other is otoba bark, and the third one is liposomal cinnamon, clove, and oregano essentials. Okay, all right. Those 3 things that my Lyme protocol, which I just showed you a few minutes ago, talks about why and how to use those. But that's where I'd start. Okay. All right. Good luck to you, Linda. Hello, Sharon. Let's see. With BPC 157, is it normal at first to get a strong brain effect but no dizziness? I took it today for the first time. Thanks. I'm not sure what you mean by a strong brain effect. If we were in a Zoom room, I would ask you to clarify what you mean by that. So I'm not aware of what you're talking about. I would need more information to be able to answer that. I should put it that way. All right. Sorry about that, Sharon. Hello, Mary. Mary says, I tried 10 months of Psittacuta hutania, still have Bartonella. Tried BLT and Cryptolepis, still have Bartonella. Any other ideas to try? So I think this one of the strongest combinations I'm using herbally these days for Bartonella would be the mixture of Cryptolepis, Japanese knotweed, and liposomal cinnamon, clove, and oregano essential. All right. The crypto I would do at a half a teaspoon 3 times a day. The knotweed I would do at 30 drops twice a day. And the liposomal cinnamon, clove, oregano essential capsules I would do at 1 pill twice a day. Now, all of those have laboratory evidence showing they treat growing and persister Bartonella. All right, so growing, but then Bartonella can go into hibernation. We call those persisters, and you need to be on something that's going to deal with those. Okay, all right. The other thing I would add to that regimen is lumbrokinase at 16 or 20 milligrams twice a day. And the reason to use lumbrokinase is to help break down Bartonella biofilm, which the cinnamon, clove, oregano is doing as well too. All right, so beyond 2 things that break down biofilm, but also Bartonella has the ability to wrap itself in fibrin, your blood clotting protein. And it basically sequesters or hides itself within these fibrin nests. So you want to break the fibrin down, and the lumbrokinase does that. Okay, all right. I talk about these ideas in my Kills Bartonella article as well too. Okay, all right. Good luck to you. Let's see. Sharon said, I think that the BPC 157 is giving a bit of a headache on the second dose. All right. What you might try to do, so Sharon, in some people, BPC 157 can actually have a weak antibiotic effect. So you might be getting kind of a Herx reaction. What you might do is start by taking 1 pill 1 time a day instead of 1 pill twice a day, or 1 pill every other day. And as your headache issues start going away, then ramp up the dose from there. Okay. All right. Good luck to you. All right, everyone. That's it. It's 7:30 here in Austin, and I've got to feed myself. I've also got to take care of my dog too. So Yeah. So anyway, I just said dog. As many of you know, I had dogs. Unfortunately, I had to. Um, my girl left us. All right, so she passed away about a week and a half ago. So I'm down to one Basenji, and it's quite a loss here. But Thor and I are getting by. We're doing fine. So, but that's why I mentioned one dog only. For those of you, so keep an eye out in your email tomorrow morning. You'll get an email from me announcing that the recording is ready to be viewed. It will also, in that email, I'll have a synopsis of what we talked about as well too. And in the email, you'll also be able to sign up for our series of webinars that begin in May. Okay, all right. Good to be with you here tonight, everyone. You guys, yeah, all had some great questions. I enjoyed answering them too. Good luck, everyone. Good night.